The question now is, when can we expect this rollout to begin? Joining us to discuss is New York State Health Commissioner James McDonald. Mr. McDonald, thank you for being with us.
Hey, good morning. Happy first day of spring.
Yeah, you got it. Good to see, even though it doesn't feel like it. Well, pharmacies across the state will now dispense 3 types of contraception without the need for a doctor's visit, as you just heard in Jessica Moore's report. Can you tell us, just to review, though, what kinds of birth control are available? And let's share that process for people that are wondering exactly what they need to do.
You know, what we did is we signed a standing order. So I'm a doctor. I signed a standing order. So anybody can walk into a pharmacy when the pharmacies are ready to either get the usual forms of birth control, either the pill, the patch, or the ring. That's the most common form of birth control people use. And when I say the pill, I mean the birth control pill, whether it's the mini pill or what people are used to, the patch you put on your body and change every week, or the ring. So that's what's available. It's what people use and what people need.
So, you know, the governor obviously makes this announcement yesterday. Are you expecting any pushback? We've seen what's been going on nationwide with obviously different local governments stepping in to stand their ground on this. What's your sense here? Is this, now that the governor has said it, you're okay in New York State, or do you sense some pushback from people that don't necessarily fall in line with these views?
Yeah, we haven't really seen pushback yet, and I don't anticipate we're going to. The pharmacy community is embracing this idea. I think the prescriber community is understanding this, but quite frankly, this is really just about access to care and about individual autonomy and health equity. It's one of those things where it's a convenience for some people. You're visiting this day, you came, you forgot something, we can take care of you. But just say you're someone who just doesn't have a doctor or aren't comfortable going to the doctor for whatever reason, we want to make sure you're able to protect yourself and choose when you want to have a baby.
So let's talk about the participating pharmacists here. When are they going to be able to roll this out? When will everyone be prepared, pharmacies, pharmacists included?
Yeah, so pharmacies are going to roll this out when they're ready. I think it's going to be a matter of weeks, not months for most. You know, we know well over 85% of the pharmacies have told us they're ready to get involved, but they have to do a little bit of training, get their staff ready to do this. You know, so I would expect in the coming weeks we'll see this, whether it's independent pharmacies or chain pharmacies. We expect nice, robust participation all across the state.
And let me ask you about that. Where do you think it's going to have the biggest impact? In the city area, more rural parts of the state? What are your thoughts?
I think it's a statewide impact, because quite frankly, no matter where you are, it's the same issue for people. And I think for a lot of people, no matter where you are in the state of New York, you're going to appreciate having this freedom to make these choices.
Now, again, let's talk about the younger generation here. And of course, parents may be understandably concerned. Do they have to worry about their teens walking into a pharmacy getting birth control without them really knowing everything they need to know about it?
Yeah, I actually don't think parents always know everything going on with their teenagers. I'm a pediatrician as well. You know, sometimes teenagers are sexually active and parents aren't aware of that. Sometimes teenagers don't feel comfortable. So I think to the extent that you can foster a relationship with your teenager, be available, and create space for these conversations, that's good for a family. But there's no age limit on this. So yeah, a teenager can go into a pharmacy, have the evaluation with the pharmacist, and a pharmacist is a professional. They're going to make, you know, the decision best with the teenager. But, you know, teenagers are making their own decisions about being sexually active. This is a tool they can use so they don't get pregnant, because we really don't want teenagers pregnant. You know, they're just not ready.
And just one last question to you. New York kind of the front runner in this nationwide, or are other states across the nation, have they already implemented something similar to this?
So about 28 states have already done something similar to this, but I think what you see with New York is there's really now a really nice reproductive health package that's coming together for women, so they can really control when they have a child, really on their terms.
All right. Health Commissioner James McDonald, thank you so much. We greatly appreciate your time. Thank you.
Thank you. Enjoy your day.
Okay, and you.